Hi, welcome back to Tea Time. I'm Lucas Miller, and once again I have Dan with me, who's going to help me out by asking me some questions that he has and that maybe other members of the audience might be wanting to ask, but not quite know how to. So we're going to,
improv this all the way.
Yeah.
Well, okay, so I'm not gay. I might be a little bi, I think. And I'm not trans, but I've had many, many gay friends over the years. And some of the friends I've had, I've been able to ask more intimate questions about things that I'd been curious about. There are different terminologies that are offensive to some. Mm-hmm. One of the first things that I learned or decided, I'm not sure where it came from, but I think I met the first person I recognized as trans back in the 90s. Okay. In the mid-90s, I think. And aside from a little bit of confusion at first, I realized that the gender identity term that I should use was how they presented. And there were a number of people that I encountered that were really disrespectful, and they'd say all kinds of mean stuff and everything, but it's like, if this person presents as a male, I would refer to them as he. Okay. I figured that seemed to be the thing to do. What would you suggest?
Well, the ethic or the etiquette procedure, I guess you could say that the trans community has been trying to introduce into society is, rather than making an assumption on the basis of appearance,
right?
It's always perfectly okay to ask what pronoun, for example, that person uses, and a good way of doing it is to introduce yourself with your own name and pronoun. Such as, hi, I'm Luke, and I use he, him pronouns.
Really?
And that opens it up for you to say, oh, hi, I'm Dan, I use...
I would think that would be rather forward.
It could seem that way at first, but with any new social custom, right, it's going to seem awkward at first, but the hope is that if we get people used to it, used to the idea of not assuming on the basis of appearance. Because the fact is, you really can't tell how someone identifies based on how they dress or how they groom or what they look like or what kind of anatomy they have.
Right.
The only way to know that is to ask them. And I think you'll find that most trans people are perfectly okay, with being asked what pronoun they would like to be referred to by.
My careful dance around the pronoun issue was to refer to them, they, their.
And some people actually do prefer those pronouns to be used all the time. And sometimes if you really don't know, I mean, I do that too. I default to they, them, and their if I don't know.
Yeah, kind of gender neutral terms.
Yeah. But it is perfectly okay. It's considered perfectly acceptable and indeed preferable within the trans community to ask if you don't know someone's pronoun, it is perfectly all right to ask. Even if you're pretty sure you know the answer, I mean, most people will look at me and assume that I go by masculine pronouns. And in fact, I do. But, you really don't know that until you ask me.
Okay.
And it kind of opens up, the opportunity for that person to make a self-determining decision, to have some control over how they are regarded by others. And that's really kind of the core of the issue, is that being able to assert your own identity rather than having an identity stamped upon you from the outside.
Right, right. Let's see. I've had a number of gay friends say, I realized I was gay when I was 3, when I was 7. I imagine it's the same thing for trans folks.
Yep.
So I guess my question, how old were you when you realized?
Well, you know, that's always a complicated question because it was not one particular moment. It was kind of a long process.
Didn't happen March 23rd,
yeah, okay,
4.
so I can tell you the exact day that I realized I needed to find a therapist and start my transition.
There you go.
And that was Pride Day 2004. Or actually 2005. I had been, hanging about at the Pride Festival. I went across the street to Browser's bookstore, which had a display of, GLBTQ books out for Pride Day. And among them was Lauren Cameron's Body Alchemy. Lauren Cameron is a trans man, lives in San Francisco, a professional photographer, who did a whole book of portraits of trans men, from like before and after their transitions, and some photographic biographies of notable trans men. And among other things, the book contained some photographs of bodies that had been modified by hormone treatment and by surgery.
Wow.
And that was the first time, I'd been sort of slowly coming to this conclusion for a long time, but I had not done anything about it because I really did not know what was possible. And that was the first time that I really saw, in real concrete terms, what I could actually do about my situation.
That's cool. That's
so cool. That was kind of one of those, when the truth kind of hits you like a freight train moments. And so I a few days later I went to my doctor and I said, help me find a gender therapist. And we looked in the phone book, and lo and behold, there was one right in downtown Olympia. So I started to see her, and I got on hormones, and the rest, followed from there.
That was one of my other questions.
But I had known from a pretty early age that there was something not right. That what the world was telling me I was supposed to be did not match up with what was in my head, and that my physical embodiment did not match up with what was in my head. And it was a long process because, of course, I was figuring out my sexual orientation at the same time.
Yeah.
And at that time, the two things were so conflated in most people's heads. The understanding of gender identity as separate from sexual orientation was not as clear as it is today.
Yeah.
So it was a very confusing issue because I was on the one hand I was coming to understand myself as some flavor of queer, but I didn't quite know what. So I mean, being born female-bodied seemed to put me in a category that wasn't quite right. It was, I knew I was not a straight woman. There was never any question about that.
Okay.
It was a little bit confusing trying to figure out my identity as a gay man when I was living in a female body.
Right.
So, I had to sort of get through all of that question, and then, and of course, at the time I was growing up, gender identity, the term didn't even exist.
Right. Right.
So there was no language to talk about it. There was no way to articulate it. So I was like, I knew this on some primal level, but it was many, many years before I could articulate it in a way that allowed me to go forward and do something about it.
Is that sort of experience fairly common, given the number
It's
of other folks?
It's probably fairly common. There are some people who know exactly who they are when they're like 6 years old.
Yeah.
And we're seeing more and more trans youth, trans children, start to assert their true gender identities at earlier and earlier ages. And both society and the medical profession are becoming much more open to that idea as we learn more and more about what gender is and is not. One of the things that I do in connection with the trans advocacy group and PFLAG of Olympia
Right.
is I co-facilitate a support group for parents of trans and gender nonconforming kids of all ages.
Yeah.
And we have several families in our group who have children as young as 4 and 5, who are anything from just gender nonconforming to fully ready to transition. So we've seen a new clinic open up in Seattle for trans youth now, and
Wow.
there's more and more research being done. I think that we're probably going to see more and more young people being able to come out at earlier ages, because now they have that language and they have that frame of reference that people just didn't have, when I was a child.
Yeah, same. It just
Yeah.
didn't exist.
Yeah, yeah.
Everything was in
So,
the closet.
but it really is. It really depends on the individual. Some people come out at when they're toddlers. Some people don't come out until quite late in life. And I don't think any reliable research has really been done on how many people come out at what age.
Yeah.
You know.
Well, there's our experience, of course, and that
Well,
could be
yeah,
fairly
that's the thing.
reliable.
All the evidence is anecdotal. I don't think there have been
Exactly.
any long range statistical studies of.
I would read that study.
Yeah.
It'd be fascinating.
Well, hopefully someone will do it.
Oh, I think eventually.
Yeah,
These sorts
yeah.
of things are what
Well,
doctoral
yeah,
theses are built
Well,
on.
exactly. And the more we have trans youth seeking transition services, and the more we have doctors making that their area of expertise, I think the more that research is going to, that data will start to be collected.
Cool, that'd be good. Given the wide variety of ignorant responses to trans folks, what is the most prevalent?
Well,
I know that gay folks are treated badly, and often by just stupid teenagers, but
Yeah,
there's,
yeah.
my question is a little leading. It's like, what
stupid
is,
teenagers in the White House even.
plenty of those. But the idea is that is there a common thread in the behavior, and what do you think that comes from?
Well, okay, so there are a lot of complicated answers to that.
Yeah.
And my inclination, just because of my own background and who I am, is to tend to want to give the political analysis of gender roles and patriarchal capitalism and so forth. And it's very Marxist and anthropological, and it would probably bore the shit out of you. But
Probably not. Probably not me.
But as far as well, okay, so negative responses, obviously transgender people are at elevated risk for violence,
Yeah.
Discrimination, marginalization of various kinds,
Yeah.
and a whole range of microaggressions. It might be, say, a trans high school student whose parents won't take their gender identity seriously, who say, oh, you're just going through a phase,
Right.
or you're just confused,
Right.
or,
Yeah.
Whatever. Right up to, say, forcing that child into conversion therapy.
Right.
Or it might be, someone who is visibly gender nonconforming, being attacked on the street.
My thought of the question is if it's possible to identify where that comes from, that would be the thing to approach
Right.
as far as
Right.
change goes, or education teaching kids, listen, this thing that you're doing is based on your having this feeling, which is not helpful, nor is it appropriate, nor is it fair, and it's harmful, and don't do it.
Yeah.
Something like that.
Yeah. Yeah, and I mean, it's only very recently that, for example, schools have taken on the task of combating harassment, bullying, and intimidation as a matter of law, especially here in Washington State.
Yeah.
You know, because, you know, it used to be that adults just really didn't have the expertise for dealing with that. And I would even go so far as to say there was a time when, you know, treating sex and gender non-conforming people in a negative way was encouraged. Because, of course, here's where I get political, that system of sex and gender roles that our society has had in place for so long exists for a very specific purpose. You know, it was designed to uphold a form of patriarchal capitalism that keeps, you know, one small group in a privileged position at the expense of all other kinds of groups. And gay people and trans people, or more specifically, gender non-conforming people, are used basically as, are made examples of in ways that are intended to terrorize everybody else into conforming.
Okay, that makes
so
a lot
that
of
I mean
sense.
that, and like I said, that's my analysis, and I'm sure you will find if you were talking to a different trans person, you might get a different story. But
possibly.
You know,
well, I grew up in a.
I was educated on the East Coast, so there you go.
I grew up in a fundamentalist religious household, and I was taught all the prejudices, all the fears, all the things to hate or discourage or to stay away from, and all this nonsense. And I escaped in '88, and I have never been happier, and I've never felt more free since then. And sometimes I look back on what I was taught and how I was supposed to feel, and the kinds of ideas and framing that I adopted were just wrong and meant to control me as a human being to keep me in line.
Yeah. Well, you know, if I can say this without, you know, in any way insulting anybody's religious beliefs or choices, you know, I do believe that patriarchal monotheistic religion, at least as it has been practiced for the last roughly 1,500 years, is one of the main pillars that upholds that system.
Yeah, I would agree.
You know,
I would agree.
And unfortunately, you know, they really don't like it when you tell them that, but you know, it is, you know, that mindset, that ideology is very much in place to reinforce those, you know, those patriarchal systems of privilege.
Okay. As far as supports go, what helps the most?
Well,
just a day-to-day kind of a thing.
Well, I have been extraordinarily lucky in my life that I have, you know, that I have family who are very supportive and accepting.
That's good.
You know, that I have, you know, been able to have, you know, friends around me that are also very supportive and accepting. That I have not been forced into any situation where I was, you know, not supported. Like I said, I came out as trans here in Olympia, and I transitioned here, and I have received universally positive responses. I mean, you know, my boss was right on board with it. I came out on the job. You know, like I said, I was able to find a therapist very close by. You know, I've had a lot of advantages that a lot of other trans people don't necessarily have.
Right, right.
But I suppose that when it comes to support systems, I would have to say my biggest supporter is definitely my mom.
Nice.
And just the friends that I've met in the course of I mean, here in Olympia we have a very for a city this size, we have a pretty large, pretty active GLBTQ community. And while I have certainly met people who are maybe less educated about trans issues, I really can't say that I've met anyone who's been hostile. So I mean,
That's cool.
I'm
I hear about
Yeah.
the hostile instances, but it seems to be from strangers rather than from people that get to know you.
Yeah.
And most of the times it's a bunch of stupid kids in a car yelling stupid things that are mean and hateful and stupid.
Yeah, and I don't know if it's just because I know other people who live in Olympia and have had negative experiences, and I don't know if it's just that people don't seem to want to mess with me for some reason. I don't know if I just look too intimidating or what, but but I also have I have to say I have other advantages and privileges that not everybody else has. I have a college degree. I have, I was brought up more or less middle class. I have, I mean, I'm white. For the last 10 years, I've been visibly male.
Right.
So
Right.
all of that, of course, goes into, I guess, I don't want to say creating a bubble around me, but it definitely gives me an edge in
Yeah, well, our culture
getting by from day to day.
Our culture generally responds to females or perceived
Negatively,
females,
yes.
very differently than
yeah.
males. White against people of color,
Exactly.
very differently.
Yes.
So that would make a difference.
Yeah.
What are the costs of medication and surgery, at least as far as that goes? I mean, I can expect, hormone replacement therapy would be one thing, and that wouldn't necessarily be too expensive.
If you are transitioning from female to male, and you're just taking testosterone,
Right.
that is relatively inexpensive. Although the price of it has gone up. I mean, the price of all medications has gone up since big pharma has taken over, of course. But of course, the other complicating factor is that it was not until fairly recently that any form of transition care, hormone surgery, therapy, electrolysis, anything like that, was covered by any insurance. Yeah. It was very, very difficult to get anything like that. I had my chest reconstruction surgery back in 2008. Before, I had a job at that time, and I had health insurance through my job, but that was not covered.
Yeah.
I had to pay for that out of pocket, and that cost me a little over $7,000.
Wow.
And that's within a range of between, you could go to a cheaper surgeon for like $5,000 or a more expensive one for like up to $10,000, depending. But now that we have not only, in addition to the Affordable Care Act, please, let's keep it, and our Washington law against discrimination that prohibits discrimination on the basis of gender identity in insurance, as well as housing, employment, and education.
That's critical.
Yeah. Insurance companies, including Washington Apple Health, which I'm on now, have to cover, all of these procedures.
Yeah, back in the 90s, there was this thing called mental health parity in insurance.
Yeah.
And insurance company were not covering mental health things. And there were a few laws, I think, in Washington state that said depression is an actual thing, and schizophrenia is an actual thing, and OCD is a thing, and all these are things, and anxiety, and like a broken leg,
Right. Yeah.
like Crohn's disease, like diabetes, like many of these others, you got to treat them the same. So, this is a good next step.
Yeah.
And needs to stay.
Yeah.
Now
Of course, it's still difficult because, of course, if you're on Medicaid, that severely limits the choices of practitioners that you can go to.
Yeah, they just don't get much of a reimbursement at all.
Yeah. Yeah. Now, fortunately, I'm with CMAR Clinic of Olympia, and my testosterone is covered 100%. And if I can find a surgeon that will take Washington Apple Health, then my surgery should also be covered. But it's a matter of finding that surgeon because there are very few. I would have to go out of state.
Yeah, it's like finding a dentist on Medicaid that doesn't want to only pull your teeth.
Right. Yeah. Yes.
They
Exactly.
love to pull teeth because they get paid for that.
Yeah. But as far as costs go,
so it's different for male to female than female to male.
Yes. Okay, so like I said, chest reconstruction surgery, basically a bilateral mastectomy, is in a range between $5,000 to $10,000, depending on the surgeon's amount of experience, where they're located,
et cetera, yeah.
Other factors like that. That's a fairly simple procedure, and that's a fairly steady price range.
Yeah.
Now, when it comes to genital reconstruction surgery,
right.
For female to male, there are two basic procedures you can have. One of them is between, say, 10 and 15,000, and the other can be up to like 50 or 60,000.
Wow.
Yeah.
And insurance won't cover that either.
It will. It will now.
It will now.
Yes. Again, if you can find the surgeon. There is one contracted with Washington Apple Health right now. And she's got, I think, a 3-year waiting list.
Yeah, no doubt.
And you'd probably have to travel down to California to see her.
And Apple Health will pay for a doctor in California?
Yeah.
Well,
there isn't one in Washington.
Oh, so you go to the nearest one.
Yeah.
Wow.
Yeah.
Wow, that was one of my other questions. Is like, being gay or trans, dealing with authorities like police and or doctors could be very, very difficult. But I was thinking in terms of doctors and stuff. And you'd mentioned before that when you were coming out, I guess, you talked to your doctor, and your doctor helped you find someone. And this tells me that you had a doctor that was supportive.
Yeah,
or
I hadn't been seeing her very long, but she was. I had not been at my job very long, and I had just gotten on their insurance.
Right.
I hadn't seen a doctor in a long time because I hadn't had any insurance up till then. So and this person was close to where I lived, and took the insurance that my job provided. So I went to see her, and I think I had only been seeing her maybe a couple of months. When I told her, I want to start my gender transition, and the first step is I need to find a therapist and get duly diagnosed with what was at the time gender identity disorder. It's since been changed in the DSM, but back then it was you had to get that diagnosis and get your therapist to write you a letter of referral to an endocrinologist who would start your hormones, and then eventually to a surgeon who would do your surgeries.
Interesting.
Yeah.
Interesting. So the transition time from the time you start to the time you finish is really what really makes a difference is being able to find a doctor and
Yes, you need to be able to find the appropriate practitioners.
yeah,
You need to be able to pay for it somehow.
somehow.
And then for those who are going strictly by the WPATH standards of care, which is basically a set of protocols set out by the World Professional Association for Transgender Health, used to be the Harry Benjamin Gender Dysphoria Association. But it's basically just a professional association that has come up with a set of what they believe to be best practices for healthcare providers serving trans clients. And one of those requirements that's basically meant to protect, not only to protect the trans client from unscrupulous practitioners, but also to protect the professional from lawsuits.
Okay. Okay.
Is that you have to undergo a certain period of therapy, with a therapist or a psychologist or psychiatrist who is competent in gender dysphoria related matters and transitioning.
Insurance covers that.
Not necessarily, not always.
Yeah, because it's not really about recovering from something.
Right. I mean, the rule is that they have to cover, if they cover it for a non-trans person, they have to cover it for a trans person.
Right.
So it depends on, I mean, if you're on a policy that doesn't cover any mental health care, then it's probably not gonna cover it for a trans person either.
There's one of the first trans folks that I met, before they would do any kind of surgery or any physical change, the person had to basically live the life of that gender publicly for a period of time.
It's called the True Life Test, and we don't know exactly who thought it up or when, but we know that it's mentioned in a pamphlet put out by an organization that served trans people as early as 1975, suggesting that a person who wanted to transition before they had any medical procedures should spend up to 1 year living in their true gender. Now, mind you, this was, again, back in the 70s when
things were more dangerous.
Well, and things were a little more clear cut. These days, somebody says, well, what exactly does that mean to live in, a different gender? It's like, how is it substantively different to live as a woman versus to live as a man these days? It's
all about the surface.
What that looks
really.
like has changed a lot in the last 30 years or so.
I thought about that
and if you have someone who identifies as non-binary, who doesn't identify as a man or a woman, what does that look like? There's no frame of reference there. There's no touchstone for.
Yeah, that would be.
So a lot of therapists have kind of done away with the True Life test. My therapist did not require it. I just kind of, I cut my hair, I changed my wardrobe, I bound my chest until I got my surgery, and I pretty much just lived essentially the same way I had been living. I mean, nothing really changed except my appearance.
Yeah, that's
and
kinda,
it was like, well, what exactly am I testing here?
Well, I think
my ability to live a certain way, or other people's ability to see only what they're meant to see. It's a very
I don't know how to feel about it. It seems
and there's absolutely no clinical evidence showing whether or not doing that 1 year True Life test improves the outcome for any given patient.
Yeah, I kind of wondered, is some sort of a psychology thing, like Well,
Yeah.
you wouldn't do it if you didn't really mean it.
Some doctor made it up thinking it was a good idea with absolutely no clinical evidence to base that supposition on.
Yeah.
And,
Yeah.
other doctors just started doing it because
It seemed like
it
the
seemed
thing to
like a
do.
good idea.
Yeah.
But, there are a lot of problems with that. When you for example, you ask someone with, and not to be crude, but I had pretty large breasts. To ask someone with large breasts to live in the world as a man, that's difficult.
Yeah.
Not only is it difficult and uncomfortable, but it can expose someone to danger.
Yeah.
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 So, the true life test, I would imagine some of the more, archaic-minded therapists still require it, but it's largely been done away with.
That's interesting. I didn't know that,
Yeah.
and it sounds good because
Right.
15 years ago I got a vasectomy, and I love Planned Parenthood. Always
yes,
will.
me too.
They're so freaking awesome. So I went there and I said I want to get a vasectomy, and they're like, "Oh, goody." Not enough men do that. And they said, "But you have to wait a month." And I'm like, "Really?" And it's like, "Well, it's part of the law. You got to make sure because this is a permanent change. It's not necessarily permanent, but it's permanent enough.
Yeah.
And you got to wait a month and blah, blah, blah." I'm like, "Okay, I'll be back in a month saying the same thing. This is
Right.
is what
Yeah.
I've decided."
Yeah.
And so I went back in a month, and the procedure was quick and simple and easy, and not completely painless, but otherwise it was great.
Yeah. Yeah.
And I thought about that. I've talked to other men that have gone to look at getting a vasectomy, and if they're under 25, they just get refused,
Yeah.
which I find troubling.
It's a funny thing. I don't know if that's a matter of state law or what, because I got a tubal ligation before I was 30 in Massachusetts, and there wasn't. I mean, there was a short waiting period, but only because of the scheduling at the clinic. They got me in as early as they could.
Yeah.
Which was a couple of weeks, but
Yeah.
they didn't tell me I had to
You have to wait and make sure, blah,
Yeah,
blah, blah, blah,
yeah,
blah. Yeah.
yeah. They said, "Well, the earliest opening we have is 2 weeks from now. Can you make that?" And I was like, "Yes, of course."
Nice.
So, I don't know. And that was in like 98 or 99. So, yeah. It's funny how different people are treated differently
Yeah.
as far as, reproductive health care is another big pet peeve of mine.
Yeah. Well, you're not alone.
But as far as time to transition, that's also a very individual thing. It's kind of like the time you spend in therapy is really between you and the therapist. In my case, it was pretty short because when I went to my therapist, I was very certain. I knew exactly what I needed to do, and I wanted it done yesterday.
What is the therapist's role in this? I mean, they're not supposed to discourage you. Are they supposed to
They're supposed to evaluate you. So my therapist had been helping people transition for quite a long time.
Okay.
So she had kind of an established, time-tested program, like a set of questions that, we're going to sit down, each session we're going to take one of these questions and talk about it and, see where you fall on this,
Spectrum.
basically. Yeah. And then at one point she said, "Okay, now we have to sit down with the Diagnostic and Statistical Manual and go through the diagnostic criteria."
Is that the DSM
Yes.
3 or 4?
I think this was 2005, so I'm thinking it must have been the DSM 4.
4R. Yeah, probably the 4R. Yeah, they've been working on DSM 5 for years and years and years.
Yeah, and it's out now, and gender identity disorder has been replaced with gender dysphoria, and the criteria are a little bit different. Still not perfect in my opinion, but better certainly than what they were.
Yeah.
And I probably made a face when she said that, because she said, you know, I'll just ask you the questions and you just tell me the truth and we'll figure out how it works.
Okay.
You know, because I mean, I was very certain of what I wanted to do. You know, and she was like, look, you obviously know what you want. You know, I have no reason to think that you're going to get, you know, halfway through this process and regret it and want to turn back. So, you know, so the therapist's role, I think, is to determine, well, it's to provide information and support,
Yeah.
to basically let that person know, you know, what the steps are,
Yeah.
you know, what they can expect, you know, make sure that they've thought about all the eventualities, that they know all the risks, and then basically help them get access to care if they want it.
Nice. Nice.
Ideally. I mean, you know,
Nice.
depends largely on the quality of the therapist, of course, but.
So, suicide. Suicide, that's a
yeah.
huge thing.
Yes. Yeah.
My partner.
Some 50% of transgender people report having attempted suicide at some point in their lifetime.
Yeah,
which is huge.
My late partner, I was with for 12 years. It was a mental health
Right.
issue, and so I was aware in the mental health community that suicide is a big thing.
Oh, yes.
It is. There are many attempts, and there are many mental health conditions that lead to it, or lend to it, or make it easier.
Right.
And trans and gay is not so much of a mental health thing at all.
No.
But being isolated,
Right.
being treated badly by ignorant people.
We call it minority stress.
Okay, there's a word for it.
Yes, yes. And it's the same no matter what kind of minority you are. If you're, you know, a person of color, or a person with a disability, or a person experiencing homelessness or poverty, you know, or, you know, a person who's gender nonconforming.
Minority
you know,
stress.
Yes.
That's I don't think I've ever heard of that.
Right.
I
You know,
understand what
we
it
have
is.
other words for it: internalized homophobia, internalized transphobia. Basically, society conditions you to,
Yeah.
you know, to have that sense of self-loathing. You know, and then of course adds insult to injury by, you know, actively discriminating or subjecting you to violence, or, you know,
Yeah.
yeah.
Yeah. So
that's probably the main cause of suicidality among GLBTQ people.
yeah, I mean, teen suicide is when I've read statistics, and you know, I did a lot of research in statistics and how they're reported, and the means by which it's done, and the all the different things. And there's it's really interesting that suicide happens in a teen cluster, usually right around puberty up until the early 20s, and then not so much up until you get into the 60s and 70s and 80s, and this kind of prime, person's prime, it's not nearly as prevalent. And so, I mean, I certainly understand why there would be facilitated groups at schools, and why that would be really important to prevent that. Have you encountered any statistics, or where's that word again? I lost the word. Is after the fact information? Anecdotal, that's it.
Right.
Anecdotal, experiential, statistical.
Yeah. Well, I mean, like I said, when we sign on to be facilitators with Pizza Clatch, they do give us training that includes, you know, how to spot when someone is feeling suicidal or having suicidal ideations, and, you know, what to do in that situation. And, you know, again, this is something on which some actual statistics have been gathered.
Oh, good.
Like I said, according to a survey done by the National Center for Transgender Equality and the National Gay and Lesbian Task Force, 50% or thereabouts of trans-identified people have attempted suicide and, or completed suicide
completed
in their lifetime. I don't recall off the top of my head how that breaks down by age, but we do know that trans youth are at elevated risk, highly elevated risk for suicide compared to their non-trans peers.
The kids that you've worked with, have they talked about how helpful the support is?
They have, actually. We ask them to fill out a survey once a year, once or twice a year, just so that we can gauge, whether our efforts are being helpful or not. And we get a lot of comments. We ask questions about, have you considered suicide? Before going to Pizza Klatch, after going to Pizza Klatch, et cetera. And I think it's fair to say that for the most part, the responses indicate that having that support space, can sometimes make the difference.
Yeah, I would like to think so, because if I were whatever, some particular thing with me, that having support makes all the difference.
Right.
Knowing that I'm not alone, knowing that there are people that I can call, knowing that this feeling won't last forever.
Right. Well, I think that, again, one of the main things that we do in Pizza Klatch, or that we try to do, is just provide an absolutely safe space in which, the participants can talk about whatever is on their mind, and know that they'll be listened to, and that they won't be judged, and that they won't be, challenged, or that they'll be taken seriously, and that they'll just be heard. Sometimes that's really what it takes, is just feeling that somebody hears you.
Nice.
But of course, for trans people that suffer from extreme body dysphoria, there's that added layer of difficulty that can also contribute to suicidality, independent of, society's, challenges.
Right. Okay.
Not every trans person does suffer from that, but for those that do, it can just be like an added factor. But anyway, go on.
Okay. Last and hardest and most uncomfortable question.
Okay.
Sex. Okay, so many years ago.
We need more of it.
Yes. Many years ago, and this is why I asked, many years ago, I ran into a person. They were female, but they were trans to female, and they were very attractive, and I was very interested. But I was afraid. I didn't know how to approach. I thought about dating this person, and I didn't. I had no experience to guide me. I didn't know what that would look like.
Right.
And everybody needs to be loved.
Yeah.
So maybe some helpful advice and suggestions. Just general things that would be helpful for others that are not, or are interested, or
This is really more Dan Savage's line than mine, but I'll do my best. When it comes to sexuality, dating, relationships, intimacy, trans people are really pretty much the same in their needs as anybody else. Although for trans people, sometimes, again, there is that added layer of complication, because what often happens with trans people who experience dysphoria, aren't always very comfortable in their own bodies,
Yeah.
which makes it harder to relate intimately to, somebody else. I went through a period, before I got my top surgery, where I couldn't even take off my shirt in front of a mirror, let alone a partner. And that of course made it difficult to relate.
What would help?
A little while after I got my top surgery and I felt much more comfortable with myself,
Yeah.
I briefly dated another trans man who had not yet had his surgery. And he felt a need to keep his binder on
Okay.
in bed.
Okay.
So it's things like that. Those are really the kind of the main differences between being intimate with a trans person versus being intimate with anybody else. But I mean all kinds of people have body issues.
Oh, yeah.
That they have to overcome in intimate situations. Now, if it's a situation where you're getting potentially involved with someone who does not know your trans status,
Right.
then there's always that awkward moment of deciding when exactly do I disclose this.
That would be hard.
It's a little like disclosing your HIV status.
Yeah.
That's another comparable kind of thing. And it's not made any easier by the horror stories you hear about. There was a woman in Denver, I think, who was on a date with a man, and she told him that she was trans, and he beat her to death. And this is part of the reason why we observe Transgender Day of Remembrance every November 20th, because that list of murders,
Right.
and it's not always, a dating or partner situation,
Well,
but that can.
Assuming
Yeah.
the potential date already knows
Uh-huh.
and is interested, what maybe some suggested lines of conversation that might.
Well, I mean, in any potential, intimate situation, there's got to be a certain amount of negotiation and, talk about. I mean, you have to deal with topics like, what kind of, are we going to practice safer sex? Are we going to, are there places that I don't want to be touched?
Right,
do I have like, some kind of post-traumatic issue that,
Issues,
I mean, there's all of that. And then, of course, if you have, if you have non-typical anatomy, at
Right.
some point you've got to bring that up and say, so look, I've not yet had surgery, or I look a little different down there than what you might be expecting, and is that going to be a problem? And it's, I don't think there is any formula for.
Yeah. The more you talk, the more I think,
yeah,
it's really an individual situation.
But I can tell you, it's a major topic that comes up in trans support groups that everybody has anxiety around, and it's one of the reasons why we try to establish support groups for partners of trans people as well, because of course it's not just the trans person who has to
negotiate.
Yeah. And sometimes change their thinking. Yeah. So yeah, that's a huge issue, because oftentimes we're not only dealing with our own personal body issues, our own dysphoria, but we're also dealing with the threat of rejection or violence or
Yep.
Yeah. But and then of course, for me, I identify as gay, which, in the gay male community, there's such a, well, not to be crude, but let's call it dick-centricity.
Yeah.
For someone who's preoperative, that's, you know, that provides a whole other layer of difficulty.
Yeah.
You know,
Yeah, I imagine.
is dealing with that particular bit of cultural chauvinism. You know.
Yeah, that's its own thing, isn't
Yeah,
it? I suppose.
Yeah. But you know, one encouraging thing is a lot of the better dating sites online have expanded their profiles so that you can be more descriptive about your gender identity, or
That would be
your
helpful.
your physical status, or you know, whatever else.
Yeah, eyes
So-
a little wider open going in.
Yeah. So, you know, as the conversation, you know, just the wider cultural conversation about gender, sexuality, sex, etc., gets more frank, more honest, more open, you know, I think maybe, you know, people's anxiety levels about that will hopefully come down a little bit.
Hopefully.
Yeah.
Hopefully.
All right.
Yeah,
So
I'm out of questions.
we're being told to wrap it up. So
Okay.
well, thank you very much for
Thank
helping
you,
us out
Luke.
here today.
This
And yeah, we should definitely have you on more often. You're a good interviewer.
and I'm just the guest. Yeah, this was really enlightening for me, and a very good experience. And I certainly got to know you a lot better. And this is a good
Well,
thing.
I hope
so.
I gave you some useful information.
Yeah.
Yeah.
Oh, yeah. This is great.
Yeah.
It's great. Thank
All
you for
right.
having me.
Thank you. Thank you for joining us on Tea Time in Olympia, and have a good evening.